Hey everybody, I have missed you all. This is Nurse Eunice with Florida Training Academy, and in tonight's video, we're going to be reviewing the Phlebotomy Certification Examination. We're going to help you pass that exam, and as we do in each of our videos, we're going to give you about 10 seconds to receive your notifications, and then we will begin. And I see a lot of you all in the chats already, so good evening, good morning, and hello, and we'll get started soon. All right, everybody. So, who is a phlebotomist? A phlebotomist is a vital member of the healthcare team who is specifically trained to draw blood from patients for diagnostic tests, transfusions, donations, or research. Their skills ensure that lab results are accurate and that patients remain safe and comfortable during the procedure. What are a phlebotomist's responsibilities? Those responsibilities include collecting blood specimens using venipuncture, finger sticks, or heel sticks, verifying patient identity and labeling specimens correctly, maintaining sterile equipment and ensuring infection control, preparing specimens for transport to the laboratory, and providing reassurance and support to nervous or fearful patients. And brown skin girl, I'm so proud of you. Congratulations. All right, so who can work as a phlebotomist or where can you work? Look, as a phlebotomist, you can work in hospitals, urgent care centers, clinical and reference laboratories, physician offices, and outpatient clinics. Mobile phlebotomy units. That's right. Those blood bank vehicles that you see around, they have phlebotomists working inside of those. You can work at blood donation centers, research institutions, and home health and insurance examination services. How to become a phlebotomist. All right, so we have great news at Florida Training Academy. We have partnered with Career Step, and yes, you can actually take your phlebotomy certification classes online with a hybrid. We actually can provide you with a clinical or externship site in your area, and you can complete the steps to become a phlebotomist. So after you register for your class and complete it, you'll have to complete your clinical rotations. That's right. You got to stick patients for real. So just not in a simulated or a classroom setting. And then you have to pass a national examination. So it's 3 steps. 1, complete your course. 2, complete your clinicals. 3, pass your test. And then you are ready to be a phlebotomist. And I'm looking at you all in the chat. I am so proud of you all. So many of you all have taken the first step. Claudine, congratulations. You've passed your CNA test. And now it's time for you. Once you get some experience and you want to go further, this would be a great next step to become a phlebotomist. All right. And so why choose our program? Because you can learn at your own pace. We have online coursework, and then you do your clinicals, your lab time at the end. A full tuition with payment plans, hands-on training options, and it prepares you for the United States National Certification Examination. So I know we get viewers from around the world, but if you're not in the U.S., unfortunately, we can't provide clinical sites to you. So we would not be able to assist you with earning your national certification. We also provide career support and resume guidance, and this is ideal for career starters or career changers. So a next progression from CNA, if you're not sure if you want to go all the way to nurse, phlebotomy would be that next best step. So how do you get more information? You can go to floridacareeracademy.com. That is floridacareeracademy.com, or you can call one of our career advisors at 877-225-7151. And without much further ado, let's get started on our practice test. Let's see how much you already know about the role of a phlebotomist. And don't forget to like the video, share it with your friends and family, and subscribe to our channel. Here we go, team. Question number 1. What is the most common site for venipuncture? Is it A, radial artery, B, brachial artery, C, median cubital vein, or D, femoral vein? And we'll reveal the correct responses in about 5 seconds. Oh, I see a lot of correct responses coming through. I'm so proud of you. All right, revealing the answer in three, two, and everybody said C, and everybody is correct. Absolutely. The median cubital vein is preferred because it's large, close to the skin surface, and has fewer surrounding nerves. So you all got that one correct. Proud of you. Question two, let's talk about those additives. Which additive is found in a lavender tube top? Would it be A, sodium citrate, B, EDTA, C, heparin, or D, fluoride? This one's a little bit tricky, so if you don't have pen and paper available, go ahead and get that out so you can start taking notes and preparing yourself for the role of a phlebotomist. All right, I see answers coming through. Revealing the correct response in three, two, and yes, you all have it. EDTA, or if you want to pronounce that long word, is right there for you on the screen. EDTA is an anticoagulant commonly found in lavender top blood tube collections. It's especially useful in hematology testing, such as CBCs, which is complete blood counts, because it preserves the size, shape, and structure of blood cells, and we refer to that as cell morphology. So if you answered B for number two, you are doing a great job. Congratulations. Question three. Ooh, this one's hard. What is the correct order of draw for vacutainer tubes? That's right, there is an order. You just can't do it randomly. I'm going to let you look through all of those options because there are a lot, and you tell me which is the correct order of draw, and we'll give you about 7 seconds. All right, 5, 4, 3, 2, and I see a lot of correct answers, but you all are all over the rainbow on this one. And so, a good hint, a good way for you to remember it is that blood cultures are always first. And that's if you have blood cultures. And then, after blood cultures, will be the light blue tubes. And so, that's my only hint for now. Revealing the answer in three, two, and if you chose B, you got it. Congratulations, Tina and Reg Ed. So the correct order is a light blue after the blood cultures. And then your serum, which would be your red tops. And this one skipped the yellow one, but green or heparin would be the next one. And then your lavender is your EDTA. And then lastly, your gray, which would be for glucose testing and also for lactose testing. And if you don't remember all of this, that is okay because we keep these color coded charts on the back of our ID badges. And so sometimes I can't remember everything. And I am a fan of picking up the phone, calling lab. Hey lab, what color tube does this lab go in? So remember, you're just passing the test. But once you get through taking your certification exam, you have a whole department, an entire team who can assist you. All right, let's go to question number 4. Which of the following is used to clean a site before drawing blood cultures? Is it isopropyl alcohol, hydrogen peroxide, chlorhexidine, or soap and water? What do you think, team? And I'm so happy to have my voice back. The last two videos were problematic because I couldn't talk. So, welcome back. All right. So, Augusta says A. Leonie says A. Everybody saying A. And this one was tricky because it didn't say clean a site before a regular lab. It said before a blood culture. And so, the correct response is going to be C. I see you, Reg Ed. Yes, it is C. So, everybody, for a regular specimen, you can use alcohol. But if your facility has chloroprep or chlorhexidine for a blood culture, that's what you're going to use instead. So, blood cultures require a more effective antiseptic like chlorhexidine to prevent contamination. Chlorhexidine or chloroprep is often used in combination with alcohol. It is preferred for cleaning the skin before blood cultures because it has residual activity, which means that after it dries, it keeps on fighting the bacteria. So, thus, it reduces the skin bacteria count and has a broader antimicrobial spectrum than alcohol alone. And so, I hope you learned something new about chloroprep, also known as chlorhexidine. All right, question number 5. Why is it important to follow the correct order of draw during venipuncture? A, to speed up the process of collection. B, to ensure patient comfort. C, to use fewer supplies. Or D, to avoid cross-contamination between different tube additives. Why do you have to care about the order in which you collect the blood? And I know this is going to be an easy one for you all. So I'm revealing that answer in 3, 2, and I knew it was easy. I knew you would get it. Amani, Brittany, Tina, and Leonie. Yes, it is D. And so the reason or the purpose for the order of draw is because each tube contains specific additives. So drawing the tubes in the wrong order can cause additive carryover, which may alter test results and lead to diagnostic errors. This is a long one, question number 6. A patient has an IV heparin infusion in the right arm. The same patient has an AV fistula or their dialysis site in the left arm, which means it cannot be used for lab draws. You are asked to draw a PT and a PTT. What is the best course of action? So this patient, you can only draw from the one arm, the arm with the heparin infusing, the right arm. So would you A, draw the sample above the heparin IV line? B, draw the sample from the same arm but far from the IV site? C, draw the sample from the left arm? Or D, consult the nurse or provider before drawing blood from the arm with the IV heparin drip? Oh, this one's tricky. What do you think, team? All right, so Child of God says D. Horphelia says D. Vanessa says D. Miss Bonita and Augusta says D. And guess what, team? You got it. Yes, that is right. So, drawing from a limb with a heparin infusion can result in falsely elevated coagulation test results. And so, those labs that were being drawn, the PT and the PTT, they are actually coagulation studies. And so, if you actually draw that lab with the heparin infusing, you are going to get an accurate test result. So if that were to happen and you see something hanging in the arm that you have to use for venipuncture, you always want to consult that nurse and ask that nurse what should be done. And most of the time, your nurse will either pause the IV or she can call that doctor if she's in the hospital to see if we can get an alternate site. So great job if you knew the answer to that. Question 7. A phlebotomist should remove the tourniquet A, immediately after needle insertion, B, as soon as blood flow begins, C, after 2 tubes are filled, or D, after all tubes are collected. All right, and I see some correct responses coming through. All right, revealing the answer in 3, 2, and this one's funny because you all have A's, B's, and C's. There's no consistent response. And yes, here we go, everybody. The correct response is B. So I know what you see in the real world, which is wrong. So you're supposed to remove the tourniquet once the blood begins to flow, and that prevents hemoconcentration or too many blood cells or having broken blood cells. So once you see the blood flowing, you're supposed to remove the tourniquet. But I know in most instances, your phlebotomists keep the tourniquets on until the very end. All right, question number 18. You got this, our future phlebotomist. Question 8. What does the term postprandial mean? Is it A, after meals, B, before meals, C, before bedtime, or D, after exercise? And I've been teaching you about those prefixes and suffixes. So we may not know what prandial means, but we should know what post means. All right, so give me the correct response in 5 seconds. Ooh, this one's hard. You all are taking your time with this one. All right, revealing the response in 3, 2, and I see a few correct responses. I'm going to tell you who they are. It looks like it is Awful J, Amani, Emma, I missed one, Elaine, and Marjorie. Yes, it is A. Postprandial refers to the period after eating, often used in glucose testing. And so we know that we check the blood sugars before meals, but for those brittle diabetics, or if we want to see if their sugar spikes really high, we will also ask you to check the blood sugar after meals, a postprandial blood sugar check. And so usually you'll see those sugars if they have uncontrolled diabetes, they'll be really, really high. And that will help the doctor determine how much insulin or how much medications to prescribe to that patient. And so if that was a new term for you, make sure you write it down so you'll know it for your future examinations. Question 9. A new phlebotomist has attempted venipuncture twice on a patient, but was unsuccessful both times. What could she have done differently to improve her chances of a successful draw? A, immediately try a third stick in the same location. B, ask another phlebotomist for assistance or consider alternative sites. C, reapply the tourniquet more tightly to force the vein to rise. Or D, ask the patient to drink water immediately before the attempt. And then, Mila, tonight we have 50 questions. And then Lisa, you're asking about the EKG examination. This one is for phlebotomists and it's based upon the test that you're taking. And so not all of them are 100 questions, but whenever you get to that point, usually once you register into a class, they will let you know what national certification exam you're going to be sitting for, and they will let you know the requirements for that specific examination. And because it's so broad, I can't give you a definite answer. All right, everybody, if you chose B, you have it. After 2 unsuccessful attempts, most clinical policies recommend that the phlebotomist seek assistance from another professional to prevent discomfort and avoid complications. Additionally, using techniques such as warming the site or selecting an alternate vein can increase success rates. Persistent unsuccessful attempts without changing technique or asking for help can lead to patient injury or dissatisfaction. Question 10, and I do see there are a lot of questions coming through, but I have to focus on the questions on the screen, so I will try to go back later and look at the chat. So question 10, which PPE is always required when performing venipuncture on a patient with HIV? Would it be A, gown, B, gowns and glove, C, gloves only, or D, face shield? And the question isn't written correctly, but it should be which PPE is always required when performing venipuncture on a patient with HIV? Filling the correct response in 3, 2, and looks like we only had one baby who got the answer right. Doesn't matter if they have HIV. you're still going to put on gloves. So the answer was C, you all. So gloves are always required when performing venipuncture, regardless of the patient's diagnosis, to protect the patient and the phlebotomist from potential exposure to bloodborne pathogens. HIV is transmitted through blood, not casual contact or airborne droplets. So PPE like gowns, masks, or face shields are only needed if there is a risk of splashing or if specified in standard precautions. So if a person has HIV or bloodborne pathogens, protection. All right, question number 11. Which specimen should be kept cold during transport? This one's hard. Would that be A, bilirubin, B, ammonia, C, potassium, or D, hemoglobin A1C? And so I'm so excited for you if you're interested in phlebotomy, because as you're learning about all these labs, you'll learn the purpose for the labs, and then the color tubes that the labs are going to be collected in, and then the order of draw on top of learning venipuncture. So you just sticking the patient and getting the blood successfully is only half of the task, because if you draw the blood successfully but in the incorrect tube, that patient has to get stuck over again. Or if you don't keep the tube on ice, that means the specimen may not be a good specimen when it arrives to the lab. And with all that being said, the correct response to number 11 is yes, it is B, it is ammonia. And so ammonia and lactic acid must be transported on ice to prevent changes in concentration. In the image here, everybody, I have 3 bags. It's actually 2 bags. And so I have a red line. And what that red line represents is how much ice you would put in the bag initially. And so if you're working in facility, if you're inside of a hospital, don't fill that bag all the way up with all the way up with ice, because most of the hospitals have labs inside of the hospital. The ice will not melt. So what you're going to do instead is maybe fill it with maybe a fifth or a quarter of ice, and then you put the specimen in an individual bag. So you're going to have one bag for the ice, one bag for the specimen. You put the specimen inside the bag on ice, which ends up being number 3, and you send that off to lab. If you are a phlebotomist in home care, that's when you probably need a big bag of ice, or what they'll also allow you to do sometimes is to have a cooler of ice in your vehicle. But that is how you would transport a specimen while it's on ice. Question number 12. Which task requires protection from light? Would it be A, CBC, B, glucose, C, PTINR, or D, bilirubin? Yeah, some specimens are light sensitive. They can be deactivated by light. And I don't know if you all hear those planes overhead, but we're not far from a military installation, and I guess they are practicing tonight because it is pretty loud. So I apologize if you can hear that. All right, question number 12, revealing the correct response in 3, 2, and I'm so proud of you. Yes, it is D. I see you, Shashi. Yes, it is D. So bilirubin breaks down when exposed to light and should be wrapped in foil. And this, again, is what you're going to learn during the phlebotomy course. You're going to learn anatomy and physiology. You're going to learn those hands-on skills. And so this is just an introduction to help you as you prepare for your course. Question 13, team. What is the first thing a phlebotomist should do when approaching a patient? Would it be A, put on gloves, B, wash hands, C, identify the patient, or D, assemble the supplies? What's the first thing that you would do as a phlebotomist if you were coming to draw my blood? I see the correct responses. Yes, team. The first question would be, hello, is your name blah, blah, blah? So yes, you want to identify the patient, because if you don't identify the patient, you're washing your hands and putting on gloves for a reason that it doesn't benefit that specific patient. And so you need to identify the patient first. Make sure that's the patient that you're actually going to be performing venipuncture on, and that is your top priority. Once you have confirmed the patient's identity, that is when you could wash your hands and then don gloves. And don't forget, because you're going to be talking to patients who may not be fully alert. So you never want to say, hey, is your name John Smith? Instead, you're going to introduce yourself and then ask for the patient's name while looking at the lab slip, while also looking at their ID band. So you're comparing the lab slip to their ID band as they are physically saying their name and also their date of birth. Question 14. I know you know this one. What is the best angle for needle insertion during venipuncture? Is it A, 15 to 30 degrees, B, 5 to 10 degrees, C, 45 to 60 degrees, or D, 60 to 90 degrees? And I'm doing my nurse dance. I'm doing my nurse dance because all of you got the answer right. All of you have the answer right. That is right, team. It is A. It is 15 to 30 degrees. That allows proper needle entry into the vein without getting too deep. So the way I like to think of it is I like to think of it as a plane coming in for a landing. So whenever you are, if you start off too high, nope. So as the plane's coming in, it gets closer to the surface and then it goes in. So 15 to 30 degrees is the level for entry. Team, why are two sets of blood cultures collected from two different sites? Is it A, to reduce the cost of testing, B, to make the patient more comfortable, C, to ensure faster lab processing, or D, to confirm infection and rule out contamination? And I hope you are as proud of you as I am, because you are rocking with these test questions. Yes, Tina. Yes, Miss Bonita. Yes, Marina. It is D as in dog. So, what will happen commonly is, depending on where you work, they will order two separate sets of blood cultures, 10 to 15 minutes apart. And so, the phlebotomist or the nurse or the tech will draw the first sample using the ChloraPrep to clean the site. And then 15 minutes later, you have to use a second site. So the person gets stuck twice. And now, if we realize that the patient has the same bacteria in both cultures, we know that more than likely that patient has that bacteria in their bloodstream. They're septic, they're infected, they have septicemia. But if we only find that particular bug in one culture, that means that more than likely the phlebotomist, the person who drew the lab, didn't clean well. So that's why we require two different sets of tubes, blood collection tubes from two different sites. And so here's our rationale. Collecting two sets from different venipuncture sites helps distinguish a true bloodstream infection from contamination by skin flora, or from us not cleaning properly. If both sets grow the same organism, it is more likely to be a true infection. Question 16. When collecting a capillary specimen or sample, what is the preferred size for an adult? Is it the earlobe, thumb, index finger, or middle or ring finger? Earlobe, thumb, index, or middle or ring finger? Where would you be sticking a patient who needs a capillary blood sample, or we call it a finger stick? All right, and I see a lot of C's and I see a lot of D's. I'm happy that no one chose the earlobe or the thumb, because that would hurt if you poke someone's thumb. And so the correct response is going to be D, you all. So the middle or ring finger provides optimum blood flow and it has fewer nerves. And something else is that we usually don't stick right in the center. We'll go off to the sides because if you stick right in the center of someone's finger, ouch, that seems to hurt a little bit more. And you're not supposed to milk it. I know you'll see people trying to milk the finger. Instead, you can use warmth. You can do a gentle massage. And don't forget that blood flows downward. So if you have the hand more dependent versus up in the air, you should be able to get more blood flow for your specimen. And then Mila asks, what's a capillary stick or a finger stick? That's usually done during blood bedside testing for like your blood glucose checks. And your facilities may refer to them as AccuChecks. Question 17. When performing a heel stick on an infant, the site should be A, the center of the heel, B, the arc of the foot, C, the lateral or medial heel, or D, the big toe. And yes, when you are getting capillary or blood from an infant, we're not usually starting IVs on them. We're going to do a heel stick instead. We're going to get some capillary, a capillary sample. So where's the best place to stick an infant? All right, we're torn between A's and C's. Revealing the correct response in 3, 2, and yes, great job, team. Yes, you have it right. It is C. So the areas that are reddened or that are striped, those are not the places you would stick an infant. So you would stick an infant on the lateral, on the outer sides of their heels. So the correct response is C. The outer sides of the heel reduces the risk of hitting bone and or nerves. All right, question 18. The purpose of inversion after collecting, don't know what inversion is that after we collect the tube, we gently invert backwards and forward. Okay. Textbook says 8 to 10 times. Most of us may do it about 5 times. But what is the purpose of inverting a blood collection tube? Is it to A, increase oxygen, B, prevent clotting or mix properly, C, to reduce hemolysis, or D, to decrease glucose levels? Why do we invert that tube backwards and forth? Congratulations, Joan. I'm so proud of you. All right, revealing the answer in 3, 2, and yes, it is B. So, gentle inversion ensures the blood mixes with the additive, preventing clotting or preserving the sample integrity. Yeah, she passed her CNA exam. Congratulations. Question 19. Which tube should be drawn first when using a butterfly and collecting a light blue tube? This one may be a little challenging, so take notes. The butterfly needle is the needle that has the wings and the long extension tubing set. All right, so which tube should be drawn first? Is it going to be A, the discard tube, B, the red tube, C, a lavender tube, or D, a green tube? Yeah, this one's tricky. It's tricky. Ooh, and I could tell that no one has used this one on you because no one has answered the question correctly. So we're teaching you something new today. Whenever we are using a butterfly device in order to draw labs, because of the tubing that's actually attached to the butterfly needle, that tubing contains air. And so your first tube is supposed to be a discard tube because we don't want all that air going into your blood cultures or going into your coagulation studies tube. And so the discard tube is used to remove air in the tubing and to ensure the light blue tube has the correct blood to additive ratio. And so even though they may not have been doing it, that's what is supposed to be done. And that is recommended by the regulatory body that supersedes or oversees the phlebotomist. Question 20. Which condition requires the use of contact precautions? Is it tuberculosis, C. difficile, influenza, or chickenpox? And yes, because we just did a whole video on communicable diseases. And so many of you all watched that video. So thank you all for watching. Hopefully, Nurse Jackie has taught you all a lot. She's helping me out. And so, you all, if you chose B, you got it right because the others require airborne precautions. So it is B. C. diff requires contact precautions, which will be a gown and gloves due to its transmission through contaminated surfaces and hands. Question 21. What is the ideal time frame between collecting the first and second set of blood cultures? And dang it, I gave you this answer already. What if this card tube was not in multiple choice? Those I would just use, because if you don't have a discard tube, you just use your blue top. So I would have to see it in a question in order to better answer your question. I apologize. All right. So what is the ideal time frame between collecting the first and second set of blood cultures? Is it immediately, at least 24 hours apart, 10 to 15 minutes apart based on provider's orders, or D, one in the morning and one in the evening? We're torn between A's and C's. We're half and half. Now I see a D in the mix. All right, for this one, you're all over the rainbow, even though I just gave you the answer. So revealing the correct response in 3, 2, and yes, it is C. So blood cultures are usually collected 10 to 15 minutes apart to increase the likelihood of detecting intermittent bacteremia. Timing may vary based on patient condition or provider instructions. So, yep, if you're collecting the first set of blood for the blood cultures, you don't want to give that to the next person. So you're doing that a few minutes later. You're coming back, and then you're going to do your second set. So they are 10 to 15 minutes apart. Question 22. I know you're going to get this one right. I know you're going to get this right. What does the term anemia mean? Is it A, excess white blood cells, B, low hemoglobin, C, low platelets, or D, high cholesterol? What does the term anemia mean? And we know about our prefixes. So A and means the lack of something. So we know it's not A. It wouldn't be an excess. Revealing the correct response in 3, 2, and yes, team. I see you, Mila. I see you, Tina, and Troy, and Amani. It is B. And so instead of saying low red blood cell count, I put anemia. So the correct response is B. Anemia is a deficiency in red blood cells or hemoglobin, which affects oxygen transport. And so when your patient's anemic, yes, they're going to be weak because the blood cells that carry the oxygen, they aren't there. They're lacking. And so they're going to get winded fast. And so all of that plays a role in how your patient is presenting. So even as a phlebotomist, you have to be wise to the fact that, hey, if I'm drawing these labs, you're going to be correlating these labs to what the patient's diagnosis could possibly be. And no, you don't diagnose. But when you're in the room sticking someone sick, it would make good sense for you to kind of figure out what's going on with them. Even though you may not be able to read the chart, all you get is a lab slip. Question 23. What is the main purpose of using a centrifuge in the laboratory? Is it A, to sterilize blood samples, B, to measure blood pressures, C, to warm blood samples, or D, to separate components of blood? What is a centrifuge used for? And so, if you are a CNA and you're working in a hospital, just ask one day, ask the phlebotomist, say, hey, do you think it's possible for me to come down and take a tour of the lab when I'm off? I'm sure they're going to say yes. And then that way you can see all this equipment and you can see what happens after the phlebotomist draws the blood. All right. So, for question 23, if you chose D, you got it right. So, a centrifuge is used to spin blood samples at high speeds, causing the heavier elements like red blood cells to settle at the bottom, and the lighter components such as plasma or serum rise to the top. This separation is essential for many types of lab testing. And then, yes, Mila, as a nurse, depending on what hospital you work at, you have to draw blood also. And if you're in the ICU or if you're in the ER, they usually don't call phlebotomy to those units. You have to be able to draw your own blood. Or if you're a CNA working in those units, remember in the hospital, they don't call you a CNA, they'll refer to you as a patient care tech and give you more responsibilities. So if you're a patient care tech working in an emergency department or in the intensive care unit. So question 24, a short draw, meaning you don't have enough blood. A short draw in a light blue tube can result in, is it A, hemolysis, B, elevated glucose, C, clotted sample, or D, incorrect coagulation results? Remember, our light blue tops are for a specific purpose. And if you only half fill it with blood, we call that a short draw. What's going to happen to the specimen? What's going to happen to the results? And everybody has it right. Yes, it is D. A short draw alters the blood to additive ratio, affecting the testing accuracy. So, what should you do if your patient is as dry as a prune? You have a couple of options. Like if we know historically, Miss Jenkins is just not the person who's going to give you a lot of blood. One thing to ask your doctor, the provider, or ask the nurse to call the provider to get permission for is maybe using pediatric tubes instead of adult tubes. So you don't require as much blood. So you won't have a short draw. Let's see. Looks like we have good news. Oh no, Priya, but that's okay, dear, because I know you're going to come back and you're going to come back stronger. I gave my written exam today. Oh no. And I know you're going to do well because you answer these questions so well. So maybe it's testing anxiety. And so before you take your test again, I want you to research testing anxiety. And if you need the questions read to you, don't be afraid to select the audio test. All right, question 25. Which blood component is responsible for clotting? Is it plasma, platelets, red blood cells, or white blood cells? And Priya, I'm going to put our email address in here. Send us your test results because I am surprised that you were not successful on your first attempt. I'm not going to say that you failed. You just weren't successful on your first attempt. You get to retake your test, but I want to see what areas you need to focus on so I can do a video on that. All right. Question 25, everybody. Which blood component is responsible for clotting? Is it A, B, C, or D? And everybody says B. And guess what? You are right. Yes, the white sticky cells, that's your platelets. So platelets or thrombocytes are essential for clot formation. So if your patient has low platelets, they are at risk of bleeding. All right, and so if you are just tuning in, we have 25 more questions to go, but I want to remind you that we have partnered with Career Step and we offer online phlebotomy courses for those who are in the United States. The coursework is done online, and then our career advisors, they help you find an internship site in your area so that you can complete your hands-on training, which would be part 2. And then part 3, you take your certification examination and you will be licensed for the entire United States. It's a national examination. And so if you're interested, the website is floridacareeracademy.com, and you can reach one of our career advisors by calling 877-225-7151. All right, question 26. After completing a venipuncture, so you finished the blood collection process, what should the phlebotomist do with the used needle? A, recap the needle and place it in a sharps container. B, place the needle directly in a sharps container without recapping. C, leave the needle in the tray for biohazard pickup. Or D, dispose of it in the regular trash if no blood is visible. All right, we have A, we have some B's. Let's give about 5 more people time to respond and revealing the correct response in 4, 3, 2, and we're torn between A's and B's, but we should never recap. So the answer is B. Once you've used that needle, straight into the sharps container. And that helps to prevent needle stick injuries. And again, you never want to recap because that means your finger is on the cap and you can actually accidentally stick yourself. Question 27. If a hematoma begins to form, you should A, continue drawing your lab, B, apply a band-aid, C, stop the draw and apply pressure, or D, ignore it. And for those of you all who don't understand what a hematoma is, it is a collection of blood beneath the skin. It can be painful. It can actually cause your patient's skin to become discolored, like a purplish color if they're Caucasian. If they are brown skin, it's like a maroon, but you can definitely tell there's a collection of blood beneath the skin. And so while you are drawing blood, a hematoma forms. What should you do? Troy put D. No, Troy, the correct response is going to be C. You're going to remove that needle and apply pressure and then notify the nurse so that we know what happens. And there are just some patients, if they have low platelets and other disorders, which I don't want to mention right now because I'll be giving away future answers, they are going to be at more risk of bleeding or having hematomas. So when you're doing your site selection, you're looking at both of those arms. If you already see a hematoma, that should tell you this person's at risk of hematomas. I need to make sure I have enough gauze and that I am prepared to stay in this room longer and apply pressure. Hey, Qualzam, that is great. You have so many skills. So CNA and phlebotomy tech. All right, question 28. Oh, let's talk about those skills, you all. Look, the robots are taking over. I just hate to say it. So I need for you to do something that the robots can't do. You need to be able to take care of patients right now in whatever role, whatever certification. Because even if the robots can change patients, can draw blood, they're not going to have empathy. They're not going to have the customer service skills. And so that's how you're going to be able to set yourself apart and make sure that you stay marketable in a time where a lot of other industries and employees are losing their jobs to AI. So question 28, which instruction should be given to a patient preparing for a fasting blood glucose test? Is it A, do not eat or drink anything except water for 8 to 12 hours? B, eat normally before the test? C, avoid water and food for 24 hours? Or D, drink orange juice an hour before the test? Okay, revealing the correct response in 3, 2, and I'm waiting for a couple more responses. Yes, it is A. Do not eat or drink anything except water for 8 to 12 hours. Fasting ensures that glucose levels are not influenced by recent food intake. So, who would require like an overnight fasting blood glucose test? Sometimes pregnant mothers have to do a fasting glucose test, but in your facilities, if you're in a nursing home, some cholesterol test, or maybe we're checking to see if somebody has diabetes or what the level of their levels, what the range of their diabetes, their levels have been for like the last 3 months, they may require a fasting test. And then in the comments, so it's a little bit distracting because I know you all are helping each other. So how many of you all think we need to have our own Facebook group so that you all can actually communicate with each other offline, off of YouTube? If you think that's a good deal or a good ideal, I want you to give us a thumbs up because I do have a Facebook group. I just don't ever post in it. So you would hold me accountable to helping you so that you can help each other. So if you think we need a Facebook group, put 1 in the chat area. And if I get 21s, I will open up that Facebook group to the public. All right, question 29. What is the function of the pulmonary vein? This one's tricky. You have to know about circulation. You got to know about those arteries and those veins. So, what is the function of the pulmonary vein? Is it A, carry oxygenated blood from lungs to heart? B, carry deoxygenated blood from body to lungs? C, carry blood to the liver? Or D, carry blood to the brain? And I want to give you a hint. The pulmonary vein is one of two veins that carries oxygenated blood instead of deoxygenated blood. So this is a vein that works in reverse. Usually veins have deoxygenated blood, but not the pulmonary vein. The pulmonary vein is so close to the lungs and the heart until it actually is A. Yes. So the pulmonary vein returns oxygen rich blood from the lungs to the heart. The pulmonary veins are the only veins in adult circulation that carry oxygenated blood. The other veins that carry oxygenated blood would be the umbilical vein, the vein that goes from the mom to the baby. That one actually carries oxygenated blood too. All right, so question number 30. Which specimen requires strict chain of custody documentation? Ooh, that's a fancy term. Chain of custody documentation. Would that be a blood culture, an HIV test, a drug screen, or a glucose level? We have C's and we have B's, and you all were slow to respond, so I know this is a new term for you. Chain of custody documentation. I'll give you about 8 seconds on this one. 7, 6, 5, 4, 3, 2, and yes, Qualzam. Yes, Akula and Kay, Miss Bonita and Marjorie. It is C. So we don't need chain of custody for HIV tests. We need those for drug screens. Imagine someone who was just in a motor vehicle accident that possibly caused injury or death. And now we have you in the lab drawing the lab results, the toxicology exam. So drug screens must be tracked precisely to ensure results are valid and legal. Chain of custody refers to the documented and unbroken process of handling, collecting, transferring, storing, and testing a specimen from the moment it is collected until the final result is reported. This protocol ensures that the integrity and identity of the sample are maintained at every stage. All right, we're going to question number 50. We're almost there. Question 31, team. On the thumb side, B, near the center of the arm, C, in the wrist, or D, on the pinky side. And we did not get a lot of responses about the Facebook group. I only saw one thumbs up. And so I will not give myself additional work by having a Facebook group. So if at a later time you think it's a good idea, you all can just email us at admin@fltraining.com, say Facebook group, and I will send you the link. And those first people can help be the moderators. All right, revealing the correct response in 3, 2, and 1. I know this one's tricky, but in order for you to be a phlebotomist, you have to know the location of your veins. You have to know anatomy and physiology. And so the basilic veins run along the medial or pinky side of the body and lies near its arteries and nerves. So it is D. And so the basilic vein is on the inner aspect of the arm. If you can't remember that, just sit with your palm up, and with your palm up, trace your pinky up, and that is where the basilic vein runs, from your pinky all the way up your arm. That would be the basilic. Question 31. The maximum time a tourniquet should remain on, is it A, 30 seconds, B, 60 seconds, C, 2 minutes, or D, 5 minutes? You all if you do D, that patient for real. Our tourniquet is a temporary tourniquet. We're not trying to decrease circulation long term. So, of course, it's not D. So, is it A, B, or C? All right, Miss Bonita's keeping track. Miss Bonita says, Eunice, you have 6 people approved for the Facebook group. All right, Miss Bonita, I won't forget. I will go ahead. We only have 4 more people that's needed. Revealing the correct response in 3, 2, and if you chose B, no longer than 1 minute, 60 seconds is all you get. So my recommendation is you meet, you greet, you do your vein selection after your hands are clean, your gloves are on. And then once you have to put a tourniquet on sometimes to figure out what vein you're going to be sticking. Then you release the tourniquet, prepare all your equipment. You can go back and clean the site, put the tourniquet back on again. So you can reapply the tourniquet, but you're not supposed to keep the tourniquet on for longer than your results. Question 33. What gauge needle is commonly used for routine venipuncture? Is it A, 16 gauge, B, 18 gauge, C, 21 gauge, or D, 27 gauge? That's right. You get to pick the needle size. So if your patient's mean to you, still choose the right needle size. Don't get the bigger needle. All right, revealing the answer in 3, 2, and that's right, Kay. That's right, Troy and Judy. It is going to be a C21 gauge. That is the common size. So a 21 gauge needle is standard for adult venipuncture. It allows blood flow, but it does not cause a lot of pain to your patient. And with the needles, it's actually opposite. So the smaller the number, the larger the gauge. And so a 16 gauge is huge. An 18 gauge is what we use for like blood transfusions. A 20 gauge is average for IV infusions. But if all you are doing is collecting blood via venipuncture, a 21 gauge would suffice. So 21 gauge is the most common for you all. Question 34. Ooh, what does CLSI stand for? And I'm going to sip some water while you look at those particular options, A, B, C, or D. What does CLSI stand for? And ZA says every facility uses a different type because most veins roll. And yes, every facility may have a different type, which is a very good point, which is why if you're going to be traveling around, you have to learn the equipment and the supplies at that facility because facility A may not have the same types of needles as facility B. And all your patients are going to say they're a hard stick, which some may be. And no, not all patients' veins roll because I've been a nurse now for a couple of decades, and not every patient's vein rolls. You have to know how to anchor the vein. And if you can anchor and stabilize the vein, that's going to prevent it from moving on you. So, question 34, the correct answer is A. Yeah, so CLSI is let me go back one slide, the Clinical Laboratory Standards Institute. And that is the organization that provides the guidelines for lab and phlebotomy practices. Question 35. A phlebotomist needs to draw blood from a patient who has an IV in the left arm. What should a phlebotomist do? It didn't say anything about the right arm, okay? So what should you do? A, draw blood from above the IV site. B, use the same arm below the IV site without notifying the nurse. C, ask the nurse to turn off the IV and draw blood above the site. Or D, use the right arm or another site if available. And so if you were here from the beginning, you remember The other question said the person had an AV fistula, a dialysis shunt in their other arm, so you couldn't use it. And so, with this patient who just simply has an IV infusing in the left arm, what is the best response? And if you chose D, like Merlano did, you are right. Y'all use the other arm. So sometimes in your facilities, there will be signs overhead saying, hey, you can't use the left arm, you can't use the right arm. If someone's had a mastectomy or breast removal, sometimes they take the lymph nodes from the arm. And if they take the lymph nodes, well, that affects the circulation of the fluid. And so if they took the lymph nodes from the right arm, well, then you can't use the right arm. If they have burns or scar tissues or AV fistula, you can't use that affected extremity. But in this particular question, it didn't say any of that. It just said they had an IV in one arm. Well, you go look at the other arm and say, hey, Miss Nancy, I'm blah, blah, blah. I'm from phlebotomy. I'm here to verify your name and that you have this test. Is it okay if I use your left arm or the opposite extremity? And if that patient doesn't say otherwise, and or if that nurse doesn't have a sign over the bed saying you can't use it, go ahead and use it. But when in doubt, ask your nurse. Question 36. Feigning. Oh, good question. Myra just made a very good point. Whenever someone has fluids infusing, you never want to go above the IV site. So even if the nurse paused it, you would still have to go below the IV site. And if that's not possible, that nurses make a phone call to let that doctor know what's going on, because sometimes we can put specialized lines in the patient and we can use that PICC line to draw blood, and that makes it easier on you because you don't draw blood from the PICC line, your nurse would. All right, question number 36. Fainting during a blood draw is called A, hemolysis, B, syncope, C, petechiae, or D, cyanosis. Yeah, what is the medical term for fainting? So proud of you. I see you. So proud of you. Yes, it is syncope. It is B. So syncope is the medical term for fainting due to a temporary drop in blood pressure or anxiety. And yes, your patients can have syncopal episodes while you are drawing blood, which is why all phlebotomists also need to know how to perform CPR, just in case, and also learn first aid. Question 37. Which of the following techniques helps prevent hemolysis during blood collection? A, using a smaller gauge needle. B, shaking the tube vigorously. C, allowing alcohol to dry before venipuncture. Or D, drawing blood too slowly. Which prevents hemolysis, the breakdown of blood cells? All right, revealing that answer in 5 seconds. In 5, 4, 3, 2, and oh, yes, if you chose C, you have it. And so letting the alcohol dry prevents it from entering the sample and damaging the red blood cells, thus reducing hemolysis. If you shake the tube too vigorously, you are going to damage, to break the blood cells. So for those of you all who chose B, when we invert gently. We don't shake it really fast because that's going to damage and it's going to cause our, sometimes your labs, especially if the red blood cells separate from the serum, they will send that back to you and they say, hey, this is a bad specimen. We can't use it. And that means you have to go back and stick your patient again. Question 38. To minimize contamination during blood culture collection, the phlebotomist should A, collect the specimen after other tubes, and we're talking about a blood culture. B, clean the site with alcohol only. C, avoid touching the site after antisepsis. Or D, collect from an existing IV line. How do you minimize contamination when you are drawing blood cultures? And you're welcome, ZA. And that's right, everybody has it, baby. Once we clean that site, we don't touch it again. It is C, touching a clean site can introduce skin bacteria into the cultural bottle, leading to false positives. Question 39. What is an appropriate response if a patient asks what tests are being drawn? Is it A, I don't know, B, ask your nurse or doctor, C, let me show you your chart, or D, I can tell you which tests are ordered? All right, I know you're going to get this one right. What separates you from a computer? Revealing the correct response in 5, 4, 3, 2, and 90% of you all answered this one correctly. It is D. Yes, as a phlebotomist, you may have a lab requisition slip that has 5 different labs on it. I'm just bringing you my doctor's order. You can tell me what he's drawing. Hey, he's drawing a BMP, a CBC. He needs a urine culture. You can't tell me anything else, but you can at least tell me what's on that requisition. Be knowledgeable of your profession. And so, phlebotomists can review the lab requisition form and inform the patient of the test being collected, but they should not interpret or explain the reason behind the test. That falls outside of the scope of practice. Referring the patient to the provider is appropriate and a professional response, but you can at least tell them what test the doctor ordered because you do have that information in front of you. Question 40, and this one's a long one. You arrive at a nursing home to collect a blood sample from a resident. The patient appears confused and is not wearing an armband or any visible form of identification. What should you do next? A, proceed with the draw and label the specimen with the name provided by the nurse. B, ask the patient to confirm their name and proceed if they agree. C, delay the collection and notify nursing staff to properly identify the patient before drawing. Or D, draw the blood and label as unidentified nursing home resident. Who, if you do D, I think I'm going to see you on the news. So don't do D. All right. So we have a patient who appears confused and you're in a nursing home. They don't have on armbands. What is the safest thing for you to do? And everybody who chose C, you have it. So proper patient identification is critical in phlebotomy. If a patient is confused and lacks a valid armband, the phlebotomist must not proceed until the nursing staff applies proper identification. And then sometimes they have their paper charts and they have an image, a picture of the person in a chart. So that's another way to confirm. But you still have to get the chart from the nurse. So drawing blood without confirming identity can result in serious medical errors and specimen rejection by the lab. So remember, you are part of a team. Go get the nurse if you need him or her. Question 41. Let's talk about those components of blood. What is the primary function of plasma in the blood? A, transport nutrients, hormones, and waste products. B, help form blood clots. C, carry oxygen to tissues. Or D, fight infection. So we know that red blood cells carry oxygen. We know that platelets aid in clotting. What does plasma do? Revealing the correct response in 3, 2, and that's right, Myla and Marjorie and Miss Bonita and Troy and Rich Ed. It is A. So plasma is the liquid portion of blood and makes up about 55% of the total blood volume. It transports nutrients, hormones, proteins, and waste throughout the body. So great job, team. Question 42. What is the proper way to clean up a blood spill that contains broken glass? A, use gloved hands to pick up the glass and wipe with paper towels. B, use a brush and dustpan to pick up the glass, then disinfect the area. C, mop the area with bleach before removing the glass. Or D, sweep the glass into a corner and alert housekeeping. All right, we're going to give you about 5 seconds on that one. And Mila, it won't be scary. Life happens. You're going to drop things. And when it does drop, because you went to phlebotomy class, you're going to understand what to do when things break. And we're torn between A's, B's, and C's. We have the whole rainbow. So revealing the correct response in 3, 2, and you're going to have a whole class on how to handle bloodborne pathogens and how to clean up spills. The answer is B. Of course, we're not going to use our hands, even if they're gloved, to pick up broken glass. Instead, you're going to use that broom and that dustpan. So the correct procedure is to use mechanical means like a broom or dustpan. That's going to help you to avoid cuts. And then after removal, you can disinfect the area with a 1 to 10% bleach solution, or that you're going to use 10% bleach, and then the rest is going to be water. Usually in your facilities, you won't smell like this bleach smell because they have different types of cleaning agents that even though they contain bleach, it doesn't smell like bleach. So that's why your hospitals, don't smell like bleach. However, they're still clean. If you don't have that solution, you clean up the broken glass, you clean up what you can on that floor, and then you call housekeeping to come and clean up or sanitize the blood smear that remains. Question 43. Why should you avoid drawing from the same arm that has an IV? And we're talking about IV fluids that are infusing. Is it A, risk of sample dilution? B, there's no blood there? C, it hurts more? Or D, the vein is collapsed? So many of you all have the right answer. We're torn. It's like 50-50 between A's and D's. And so let me remind you that if a patient has fluids infusing, that vein should not be collapsed because of the fluids. It should be nice and supple and full. So the answer is not D. So if you chose D, I want you to think about that again. If we have a bag of normal saline or sodium chloride hanging, those fluids could actually dilute your blood sample. So the correct response is A. IV fluids can contaminate and dilute blood samples, causing inaccurate results. But also with the sodium chloride or normal saline, because we have sodium infusing in that line and in that arm, if you collect a specimen, your nurse should be aware that when she gets those lab results, that if the sodium is high, it's because the phlebotomist probably did something wrong. Or they have to know that, hey, the phlebotomist drew blood in the arm that had saline with sodium infusing. So that can cause a false high reading for the sodium level. So for everything you do, how they say there's an equal and opposite response. So if there is fluids infusing and that's the only arm that you can use, as we said in our other slides, you're just going to ask the nurse if she can pause the fluids for a little bit. And if the nurse refuses to pause the fluids, you would actually stick the patient below the IV site. Question 44. Under what circumstances is it acceptable to draw blood from a foot or ankle vein? That's right. Veins are just not in the arms and the hands. They also go down to the feet. So would it be A, when the arm veins are difficult to locate? B, only with a physician's written order? C, anytime the patient prefers it? Or D, when drawing a fasting glucose test? I've only had to use the feet a few times as a nurse. But if you look at your feet right now, I bet you will see some supple veins because you're well hydrated. And so sometimes we have to use a foot. And yes, you are correct. We got to have a doctor's order because that is non-conventional. So foot and ankle veins carry a higher risk of complications such as thrombosis. And if you've been watching our medical terminology videos, you should know what thrombosis means. They should only be used with a physician's approval, which needs to be in the chart and you need to see it. especially in patients with diabetes or circulatory issues. So thrombosis, everybody, can someone put that in the comments? What does thrombosis mean? And then we'll go to our next question. All right, waiting for a response. I know, pull it forth, pull it forth. It's okay, Tina. All right, giving you about 10 more seconds. What does thrombosis mean? I know that you know this, team. Yes, Mila. Thrombosis is a blood clot. That's right. So if somebody has, and Elaine put it there too, and Marjorie put it also, if we start using those foot and those ankle veins, we're putting our patients at risk for a blood clot. All right, question 45. What is the purpose of the bevel on a needle? Is it A, prevent clots, B, increase pain, C, aid in vein penetration, or D, stop bleeding? Why does a needle have a bevel? No, Marina, they will only help with exam and internship if you complete their program. So I recommend contacting whatever program you completed and just telling them you need additional help with that internship. I know that can be complicated if the school isn't helping you find a site locally. All right, so everybody, for question 45, the purpose of the bevel is C. The bevel edge helps the needle enter the skin and vein more smoothly. So if you ever take our classes here, you're going to hear me say bevel up, bevel up. So bevel up is the right way. So it's going to be the opening of the needle should be facing up towards you. And that sharp part of the needle should be the closest part to the skin. So that's what we mean by bevel up. Question 46. Why should patients be instructed not to hold their breath during a blood draw? And Black, good luck on your test on Monday. All right, so why should patients be instructed not to hold their breath during a blood draw? Is it A, it increases oxygen in the blood? B, it causes dizziness, fainting, or syncope? C, it makes the blood flow more quickly? Or D, it helps locate the vein better? All right. And so whenever someone's about to experience pain, we like to tell them, hey, hold your breath. No, don't tell them to hold their breath while you're about to draw their blood. Tell them to take some deep breaths in and out. All right, Miss Nancy, let's take a deep breath in and out. Breathe with me because B, you all have it right, like 100% of you. You have it right because holding one's breath, oh, that's loud. Holding one's breath during venipuncture can lead to vasovagal reactions, which means their heart rate can drop. When the heart rate drops, that means the cardiac output and the blood pressure drops. So vasovagal reactions such as dizziness or fainting due to reduced oxygen flow and changes in blood pressure. Patients should be encouraged to breathe normally and stay calm, or tell them to look away. All right, question 47. Oh, all right. So we talked about platelets, we talked about red blood cells, we talked about something else too, plasma. So what is serum? This is another component of the blood. Is it A, the liquid portion of the blood that contains the clotting factors? B, the portion of the blood that includes red and white blood cells? C, the part of the blood that forms the buffy coat? Or D, the fluid remaining after blood has clotted and been centrifuged? You remember what the centrifuge does? It spins it, spins it, spins it, and separates. That's your hint. All right, revealing the correct response because this one's hard. I don't see any correct answers yet. In 5, 4, 3, 2, I see 2 correct answers, Elaine and Tori. Oh, Miss Benita and Amani. Yes, it is D. Serum is the clear fluid that remains after blood has clotted and the clot has been removed by centrifugation. It does not contain clotting factors, unlike plasma. All right, question 48. We're almost done with our 50 questions. I am so proud of you. And if you have not liked, shared, or subscribed, go ahead and do so. We're so close to 1 million subscribers. And we have another nurse on the team, Nurse Jackie. So Nurse Jackie comes on every Monday and she does the CNA exam prep at 7:30 p.m. Eastern Standard Time. But she's actually in Chicago. And then on this Saturday, Saskia will be here translating our videos from English to Haitian Creole. And someone asked, well, Eunice, why don't you do the videos in Spanish? It's not because I haven't been trying to, it's because I don't have a Spanish translator yet. So if you think you know of somebody who understands basic medical terminology, who would be a great addition to our team, tell them to send us a resume to admin@fltraining.com. And for question 48, how long should pressure be applied to the venipuncture site after drawing blood? Is that going to be 5 seconds, 30 seconds, 50 seconds, or until the bleeding has been controlled? Think about these different patients and all of their conditions. How long do you apply pressure for? That is right, Marjorie and Lois. As long as it takes. The answer is D. Look, there's no specified time. That patient could have been on an anticoagulant. That patient could have some other medical conditions. And so you're not going to say 10 seconds, 15 seconds, or 30 seconds. I'm going to keep holding pressure until it's not bleeding. So pressure should be applied into the site until the bleeding has completely stopped, which is generally 1 to 3 minutes. Failing to do so increases the risk of hematoma, bruising, or continued bleeding, especially in patients on blood thinners. And thank you, Amani, for sharing the videos. Question 49, team. Which of the following conditions can increase a patient's risk of prolonged bleeding after venipuncture? That's right, you got to know some anatomy and physiology. So is it going to be liver disease and a low platelet count? Hypertension, asthma, and diabetes, arthritis, anemia, and high blood pressure, or obesity, dehydration, and anemia? Which conditions increase the risk of bleeding? All right, I'm not seeing a whole bunch of answers coming through. Revealing the correct response in 3, 2, and Mila, Awful J, Black, Thick and Sexy, Ridge, Ed. Okay, it's a lot of you all now. Miss Bonita, Jeanette, and Lois. Yes, you all have it right. It is A. Liver disease, y'all, when the liver messes up, they can start bleeding. So liver disease affects the production of clotting factors and low platelet counts also impairs the body's ability to clot. Both conditions significantly increase the risk of prolonged bleeding after venipuncture. So remember, you walk in the patient's room, petechiae would be like little red blotches, hematomas, thin skin. You see any of that? Be prepared to apply pressure for a longer period of time because more than likely your patient has an illness that you're not aware of, not something that's contagious, but something that's just going to make them bleed longer. And you want to be prepared for that in case it happens. Question 50. What is the first action a phlebotomist should take immediately after experiencing a needle stick injury? I hope it never happens, but it's a possibility that it will. And when it does, should you A, finish the blood draw before reporting the incident, B, wash the area with soap and water, then report it to a supervisor, C, apply a bandage and continue working, or D, ignore it if there is no visible blood? And in each of my videos, I hope I hone in on the fact that you got to take care of yourselves, that you matter too. And so if you get stuck by a needle, what should you do? That's right, Sashi. That is correct, Marjorie. Look, you got to stop. I'm sorry, Miss Miller, I have to leave your room. I'm going to wash my hands. I want to get your nurse in here. You know, you make sure they're not bleeding. You take care of them, bandage them up. But then after you get them settled, I need you to take care of yourself because the proper first response to a needle stick injury is to wash your hands thoroughly with soap and water, That's going to help to reduce the risk of infection. And then you must immediately notify your supervisor, and they will usually send you to employee health if they need blood drawn to make sure that you didn't have anything, to make sure the patient didn't have anything. All of those chains of action we put in place. And then let's say the patient had something that was possibly communicable, like HIV or AIDS, they can put you on a prophylactic medication. And of course, you're going to need more monitoring, but prevention is the first step. So don't be drawing blood when you're distracted. And don't recap needles. Use those safety devices that are on your needles, and that will help to prevent needle stick injuries. And so Miss Benita said I answered twice. And so you all, we're almost at the end of our video. I'm going to stay around. And if you haven't been here, yes, we have partnered with Career Step to offer phlebotomy training programs. And so many of you all, you've taken our PCT courses, our medical assistant courses in partnership with Career Step. And one of the wonderful things that I love about Career Step is that they help you with your externship. So it's just not like, oh, you're taking a class online, because after you get taking your classes online, you need that hands-on experience. And so if you want to speak to one of our career advisors, the number is 877-225-7151. You can go to floridacareeracademy.com, scroll down. You're going to see about 12 different nationwide options that you can take, because remember, we have to be better than these computers. I want to make sure that my students are AI resistant. And so if you have a hands-on skill, if you have a trade, that's going to help you be more marketable and competitive in a downward market. And everybody, great job. I'm giving you applause. Great job, team. I appreciate you all so much. And Miss Benita says, good night, you all. Mila, you did so well, Mila. I cannot wait for you to take your CNA examination. It's coming. Amani, you're welcome. And if anyone has any questions, don't forget, Priya, I need to see your test results, because I can't believe you did not pass that exam on your first attempt, but we're going to make sure you pass it on your second attempt. And you all, my interns, will be available this weekend. So if you have any video suggestions, something you want to see that I haven't recently done, go ahead and put it in the chat. If you want to see the list of videos we have done recently, go to our playlist that's on YouTube. You'll see a playlist for CNA practice questions, and also a playlist for our clinical skills videos. And Judith says, shalom, everybody. Black, we know you're going to do well on your test. Jeanette, you be blessed also. And I'm going to stick around. I'll end the video, but I'll be in the chats for about 2 more minutes, everybody. Good night. I'll see you all next Wednesday.